No.
Diego, it's not. And I had it on video. Hello? Hello? Okay.
Yeah.
Can I hear you now, Harold?
Thank you. Good afternoon, everyone.
Good
I'd
afternoon.
like to call this special meeting to order. Today is January the 26th, 2021. The San Miguel County Board of Commissioners will hold a special meeting on Tuesday, January the 26th, 2021, beginning at 2 p.m. This meeting can be viewed online at www.co.sanmiguel.nm.us. Notice to people with disabilities. If you are an individual with a disability who is in need of a reader, amplifier, qualified sign language interpreter, or any form of auxiliary aid or service to attend or participate in the hearings or meetings, please contact the San Miguel County Manager's Office at 505-425-9333 at least 1 week prior to the meeting or as soon as possible. Public documents, including the agenda and minutes, can be provided in various accessible formats. Please contact the county at the above number if a summary or other type of accessible format is needed. At least 72 hours in advance of this meeting, the following agenda for today's meeting was posted and available for public inspection on the San Miguel County website at www.co.sanmiguel.nm.us and also available at the office of San Miguel County Manager. First order of business is roll call.
There's somebody from the clerk's office.
Can we have someone from the clerk's office please take roll call?
Hello, good afternoon. Can you hear me?
Yes, we can.
Chairman Harold Garcia,
Present.
Madam Vice Chair Janice Varela,
Presente.
Commissioner Max Trujillo,
Present.
Commissioner Martin Sena,
Present.
and Commissioner Kenneth Medina.
Present.
Let the record reflect that all 5 commissioners are here and we do have a quorum. Next item is the Pledge of Allegiance. Commissioner Trujillo, can you lead us in the Pledge of Allegiance?
I pledge
I pledge allegiance to the flag of the United States of America and to the republic
For which it stands, one nation, under God, indivisible,
with
with
liberty
liberty
and
and
justice for all.
justice for all. I
I
salute
salute
the
the
flag
flag of
of
the state of New Mexico,
and the
the
Zia symbol
symbol
of
of perfect friendship
amongst
among united cultures. Thank you, Commissioner Trujillo. Next order of business is approval of the agenda. Do we have any questions on the agenda? And if so, please ask now or make any comments. Hearing none, do we have a motion to approve the agenda as submitted?
So moved.
We have a motion by Commissioner Martin Sena. Do we have a second?
Second.
We have a second by Commissioner Max Trujillo. All in favor signify by saying aye.
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 All those opposed, same sign. Motion carries. We have an approved resolution, an agenda, excuse me. Okay, the first order of business is resolution declaring drug abuse, alcohol abuse, and addiction a public health crisis in San Miguel County. And we are going to have our sheriff, Mr. Chris Lopez, be the presenter today, along with a few other members of the community. Sheriff Lopez.
Chairman Garcia, it's an honor. Commissioners, it's an honor to be here before you today to talk about such an important event. You know, it's been a lot of work and a lot of effort on and be here on with this group of individuals to present to you. There's a lot more people that are involved and a lot more people who have put a lot of effort into this, and I think you're going to be pleased with the presentation today. So with me today, I have Yolanda, Matt Probst, Dr. Rocky Romero, and DA Tom Clayton. That's going to be the panel, and we'll go ahead and we'll go ahead and get started. So again, it's you know, it's been several years in the making, and when I say a lot of people, I'm talking about the Mora San Miguel Guadalupe Local Collaborative 4. MSG LC4 is the local collaborative that we're working with in the terms of this project. You know, I know that there's been a lot of resources put forth towards the fight against drug abuse and addiction. There's a lot of people that are moving to help our community, and with that, I'll let Yolanda give you an idea of some of the efforts and the work that's went into that.
Thank you, Sheriff. It's great to be here and to see all of you again. My name is Yolanda Cruz, and I've been a member of MSG for over a decade. MSG actually began in 2005, and a comprehensive recovery center has been a need and a dream here for ever since it got started. I first came into this work when Steve Flores and the San Miguel County Detention Center Citizen Advisory Council were working with the MSG and the Health Council and others. With the leadership of Patricia Gallegos, who was with the state of New Mexico at the time and assisted us, we were able to gain additional resources for outpatient treatment in this area. The San Miguel Detention Center also worked with Dr. Ray Martinez and Pat Leon to conduct a health impact assessment, which led to the Reintegration Center. Now with key partners like Kim Valdez-Blea at New Mexico Highlands University, Desiree Martinez with the San Miguel County Substance Abuse Prevention Coalition, Sheriff Lopez, the District Attorney's Office, and Tom Clayton, Matt Probst, and everyone at El Centro, Elaine Luna at Luna Community College, and the Montañas del Norte Area Health Education Center, Rocky Romero and Dr. Rocky Romero, and many, many more partners were able to come before you today to really ask for your support, your continued support from the county leadership and commission. We're ready to make this dream a reality and take the next steps along with you. And together we can make the Comprehensive Recovery Center dream a reality, and this will be your legacy.
Thank you, Ms. Cruz.
Thank you, Yolanda. And you know, the reason I really wanted to talk about that is just to show you guys a little in depth of just how many people are involved and how long this initiative's been in effect. So, you know, moving forward, I know we worked on developing an initial plan, which we put a lot of effort in that back in my days as at that time as the chief of police, and you know, in terms of law enforcement, I see it as a two-pronged approach. We have enforcement and we have treatment. And so in terms of what we're working on here, it's on the treatment side, and it touches on so many aspects. You know, when it comes to crime, you know, there's a lot of crime that happens because drugs are involved and alcohol is involved. And so if we can curb that, it'll really help us in meeting the efforts of helping our community and reducing crime. But in terms of our initial plan and how this started and how we grew and how everything grew and how we started working with our legislature and with the state of New Mexico, I'll let Matt Probst give a little bit of history on that.
Thank you, Sheriff. Thank you, Yolanda. Commissioners, thank you so much. The history goes way back, as Yolanda described, but it was about 6 years ago that two wrestling coaches, one from East and one from West, coaching junior, decided that we didn't have to battle each other and compete in juniors, that someday would come and we'd wrestle against each other for district and state championships. But at that young age, we could bring our kids together, iron sharpen iron, and forge a championship team to go win national championships. And we did. We won national champions under one banner, New Mexico Gold. And not just for our community here, but for those that had to leave for job opportunities, for jobs in Rio Rancho, to say we are still a part of this community, and the day will come where you can come back and there'll be opportunity and safety for your kids, and you're still a part of us. And so that relationship as teammates began to forge healthcare and law enforcement, saying there's got to be a better way. There's got to be a better way than arresting people over and over until they die of addiction. And that being said, these aren't just those people. These are our family, our community, the people we grew up with. And so with that, saying there is a better way. It's called trauma-informed care. And as I was studying and looking at a way to save my sister from her own addiction, I had found that research coming from Europe and this new path. And so a long time ago, and now I said it's an emerging way of care for America, but it's well proven in Europe, and now it is the way in America. And so with that, we started forging this relationship, and we said, well, we need to restart a collab. We need to come together. There's a lot of people that have this same idea. And that very first phone call from the sheriff to Yolanda saying, how do we do this? And she said, well, let's get MSG going strong again. And with that, not just us, but dozens of people first joining, and now we're into the hundreds of folks working together to create a safety net and to say, here are all the pieces of what comprehensive recovery mean for these 3 counties. Now, what's all on the table? How do we work together? Where are the gaps? Let's prioritize those gaps and work together to fill those gaps. And those gaps, as Yolanda said all along, has been residential treatment. There's never been a residential treatment center on this side of the mountain. There is only one residential treatment center north of Santa Fe, and that's in Española with oil recovery right now. And this dream of saying we can do this here, we need this here. And so with that, we had a planning grant. And with that planning grant, we were able to really study back to those key partnerships that Yolanda described, to really say, well, what are the gaps? What does the community think? What do we need to work on to make this dream a reality? And what are all those other missing pieces? And so in that planning grant and that executive summary that you all have, the commission has, and the support all along the way, we were able to study that using science and say, okay, well, yes, we need a residential treatment center. To get there, we also need workforce development for healthcare. So that's a key part of this. Many other pieces that we need to expand outpatient, and we've done that. Just at Centro alone, in 2018, we were treating 408 patients. We treated 408 patients with medical assisted therapy, with MAT medication for opioid use. And by 2019, that was over 1,000 patients. And 2020, yes, the pandemic has set us back a little at 823, but it's still double what we did in 2018. And that being said, every agency has expanded. The hospital has for us detox now, and it's, that's not yet what we want it to be, but it's a big start. There was no detox program in Las Vegas, and now that's here. Rio Grande expanding their IOP program and drug courts and on, a lot of outpatient programs. So I describe it like a river. We've really strengthened that middle of the river even more with more programs and outpatient. But there's 2 other parts of comprehensive recovery that we need to work on. And those other 2 parts are the precipice downriver. From that area of addiction and outpatient is a much scarier place. It's a precipice. Think about Niagara Falls, and when people are falling off that cliff, outpatient isn't enough, and we need to do everything we can to save them. 6 years of coming before you and 6 years of hearing your support so many times, but 6 years of obituaries and 6 years of funerals. And the time is now, with rising cases of addiction in this pandemic. The time is now. We can't wait any longer. 2021 is going to be the year where we finally have residential treatment for our people, and we are going to save many, many lives. So that's that part. Now, upstream from that is primary prevention and youth work and juvenile justice and all those other pieces that the collaborative works on as well, and Dreams for a Youth Center and other things that we're doing for primary prevention. If we can catch them upstream, like good fishermen up there in those beautiful mountain streams, if we can catch them up there to prevent them from ever needing outpatient care, we're doing a good job, and again, keeping them off the precipice. So we're trying to strengthen both pieces. With that, it is in our hands, you know, so many things that we cannot control. But right now, thanks to the work that the foundation we laid with the planning grant, from there, El Centro moved on to an implementation grant. And that implementation grant was about strengthening not just the local collaborative in Mora, San Miguel, and Guadalupe counties, but strengthening the region with cornerstone partnerships. And so expanding beyond our local partnerships that we had here with the planning grant, we expanded to the Department of Health, to HSD and BHSD, combined their area health education centers, UNM Project ECHO. And those are really cornerstones for healthcare, workforce development in our state. And so we've been now working on a 3-year grant. We're into year 2 of that, just started year 2, solidifying those relationships, which really bring forth state support to have this residential treatment center and have that strong foundation that we've been building on laid and ready so that we can have success. And so the time is now, commissioners, and I thank you all the way for all the support. I don't need to tell you the need. We know it. We have it in our own community, in our own families. When I talk about obituaries and I talk about funerals, I've seen you there. We've been there together, and let's end the pain. And so thank you for everything you've done. The time is now. Sheriff.
Thank you, Matt. I appreciate that. And for laying the foundation for them to help understand all the work that's went into this. So in terms of how I gave you a little bit of a synopsis in terms of how it affects law enforcement and crime. But I also have DA Tom Clayton to talk about how it works into the criminal justice system and the effects it plays there, and how it could help us in that initiative as well.
Look, Sheriff. Okay, I appreciate it. Chairman, commissioners, I want to say thank you for the opportunity to come before you. I stand in support of the efforts being done by the sheriff and Matt and Yolanda and everybody, Dr. Romero. I think we have a lot of opportunities before us. You know, I think substance abuse touches all our families. I don't think none of us are immune from it. You know, I know Matt talked about his own personal struggles, and I know many have suffered from it. My nephew died from a drug overdose 11 years ago. You know, he was all of maybe 23, 24 years old, and he died. And he went to treatment. And when he walked away from the treatment, he did what a lot of addicts do. They go straight back to the substance, and he overdosed. And so my mother had to bury her grandson. He was my godson, Joshua. And so all of us have suffered through the problems that substance abuse bring. And so from my perspective as a prosecutor, I want to see what we can do to divert, as Matt talked about, upstream. You know, create an opportunity for our people here in this community. And our youth, but also some of the old hardcore individuals that have been using substances for a long time. We need to do something better. And I think we have a lot of opportunities here in the community, but there is a gap. And this is a residential treatment facility. There is an absolute need in our community. Now, I've looked at the statistics. You know, I've been here at the DA's office 16 years. And in the 16 years, we prosecuted 27,000 cases. 10% are drug cases. And you say, well, only 10%. Well, that's 10% too many. But I can tell you from my experience, 90% of all the cases we prosecute have substance abuse as an element. whether it's a larceny, a burglary, a murder. You know, many of the homicides we have, substance abuse is a component. It may not be one of the charges that the individual faces, but he or she has a substance abuse problem. So if we address this, we can address crime across the board. Now, I looked at our statistics from last year, and this was the fiscal year that just ended in July of this last year. 1 in 5 cases is a probation violation case. That means we're putting individuals on probation. And I think there's this idea that we send a lot of people to prison on drug cases. And that's just not accurate. Many of the individuals that are possession type cases, it's probation. We give them an opportunity, but we're only providing half of the equation. And that is placing them an opportunity to get treatment. But if we don't provide the tool at the other end while they're on probation, then we're failing them. And I think we have an opportunity now. I think the circumstances are such that we can provide an inpatient. I mean, there are some providers that are providing outpatient, the MAP program that Matt's talking about, the medically assisted treatment, the treatment over at the jail. I know COVID has really put a damper on a lot of the opportunities that we have and the treatments that we're doing, but there's still outpatient available here in the community. Can we increase that? Absolutely. But the gap that is so glaring, and it's been for so many years, is the lack of inpatient. We need a facility that we can deal with our individual hands-on right away, quickly. And that's not happening. You know, every day when we deal with substance abuse, the defense counsel, the defense lawyers ask, where can we send them? It's usually Albuquerque, Las Cruces, Carlsbad, Hobbs, all these facilities in the southern part of the state. And we don't have any for our own. And so this is, like I said, this is an opportunity. This Epiduran building, as I understand it, is an opportunity. I don't know what the square footage is. And I know it's a big investment. It's huge. But I think our community is worth it. I think we have a wonderful population, a culture that is just amazing, a history that goes back not just hundreds of years, but many hundreds of years. I think it's time for us to come forward with the strength of the commission and hopefully others. And so I ask for your support. I stand in support. I want to see what we can do to help our community. And as the sheriff stated, we can't just arrest everybody and put them in jail. Now I can tell you from my perspective as a prosecutor, if they're going to sell drugs in our community, I'm going to ask that they go to prison. But if you're an addict, there's a difference. Let's try to help them so that they don't create a need for these other people to be selling dope to them. We have to have an ability to help our own. And I think this is an opportunity. I thank you for your time, and I'll stand for any questions.
DA Clayton, I have a question. This is Commissioner Garcia. Mr. Clayton, can you hear me?
Yes.
It's Harold Garcia. Yeah, I have a question. You said, was it 27,000 in the 16 years that you've been here?
Yes, well, since January 2005, and it was through the end of 2020, it was 26,578 cases were prosecuted. And that's not just San Miguel County. That's all 3 counties, Mora, San Miguel, and Guadalupe. But 27,000 cases.
And how many of those are repeat offenders?
I don't have those statistics, but I can provide them to you, Commissioner, and I can get it to you, Mr. Chairman. I can provide you which one are the habitual offenders. And that is a problem. We do have an element of the criminal that continue to violate. Just like this last fiscal year, we had 1 in 5 were probation violations, and that could be technical violations as well as new offenses. But I can provide you, but I would say a fair number of the cases we prosecute include habitual offenders, most definitely.
Thank you very much.
Yes, sir.
Any other questions from anyone else before we proceed with the presentation? Sheriff Lopez, go ahead and proceed.
Thank you, Chairman. So, in terms of the facility, and I know DA Clayton brought up the Epi Duran building, which is why we're here today. We've been afforded an opportunity to possibly obtain that building for an inpatient facility and crisis center. And so that's why we're having this special meeting today in hopes of getting your support to move forward with that initiative as we deal with the state and trying to make that a reality. So in terms of the Epi Duran facility and our plan, I have Dr. Rocky Romero, who's really the mind behind the plan, and he's the one that put everything on the document that you have before you. And I'll let Dr. Romero kind of explain the plan and the idea that we have behind all of this and how it would work.
Sheriff Lopez, before we have Dr. Romero proceed, can you, for the listening audience, can you identify which is the Epi Duran building?
Yes, so the Epi Duran building is the old HSD building across from the state hospital near Gallegos Road, on the opposite side of the state hospital.
Thank you, Sheriff.
Yes, sir.
All right, Sheriff Lopez, thank you so much. And Chairman Garcia and other commissioners, thank you for allowing me to share some time with you today. You know, I've often shared with Sheriff Lopez and with Matt and with Yolanda the unique opportunity that San Miguel County has and this community and this region has to really be an example for other members of our state, cities within our states and in this region, to really show what a partnership between law enforcement and behavioral health services can be in terms of a comprehensive approach and a continuum of care to treatment. As Sheriff Lopez mentioned, part of what we're here to ask you today is to serve as fiscal agent for us seeking the Epi Duran building and renovating that. Part of what we're trying to accomplish here is really looking at, one, having public safety as a cornerstone to this center, and really being able to provide safety to your constituents in the community, where individuals that may be in need of a safe space to stay for the day, for the night, and then in the morning be offered services. Those are the things that we want to see in this continuum. And I'll explain each of these a little bit more in detail. This center, we think the Northeast Regional Crisis and Treatment Center can serve as an access point to quality care and to be a part of the continuum that we know through research shows that individuals that seek treatment and get treatment at least for 1 year or longer have a much greater likelihood that they will sustain that recovery into long-term success. And we're seeing that with the El Centro Family Health Semillas de Esperanza program that hires peer workers to go and do this work after they've graduated and have some level of sobriety. For this center, what we're seeking is also economic and workforce development. We see the opportunity here not to only train interns and future practitioners, social workers, nurses, etc., but we also see it as an opportunity to create a center of excellence within this regional center to offer professional development. And that may be another revenue opportunity to help fund this center. But in order for us to really get to a place where we can provide safe access to long-term services through crisis triage, part of what we had to do is identify public and private funding. And right now we're seeking public funding. We did have a plan that we submitted for federal funding that wasn't approved at this point, but we're still gonna seek that as far as phase 3 of this plan. So what I wanna cover with you briefly right now is phase 1 of the plan. If you have the plan in front of you, it is under the public and private funding, and then it goes into our proposed phase-in implementation of services. What we feel is extremely important is that the county serving in this role, we've discussed the opportunity to create an advisory council that would then have agencies throughout the state and in this region apply to become contracted providers within this Northeast Regional Crisis and Regional Center. And what we're hoping to do is to be able to identify partners that have longstanding relationships in the community, and also are accredited and licensed through the state and federally to be able to provide high level of services. So phase one of this proposal goes into developing the Northeast Regional Crisis and Treatment Center. We're looking at a 10-day social model detox, but as Matt said, with some of the impact of COVID and that creating an impact into health, we may also look at identifying the medical component to the detox program at this facility as well. Given that we have such a close relationship to the Behavioral Health Institute, we think that would really work well in terms of clients that have comorbidity of addiction as well as mental health, mental illness. We would also include it in that. So that would be 10 available beds at any given time for law enforcement, EMS, families and community members to make a referral for their loved one to have access immediately in the community to a 10-day detox program. In addition to that, we want to have a linked program within the same facility that would include a 28-day inpatient substance use disorder program with 25 beds. And given the location that we're talking about, the Epi Duran building, there's more than enough space in that facility to create that and even to expand into phase two that we'll talk about here in just a moment. The fourth component of this phase one that we're asking for approval today to move forward with is the Crisis Triage and 24-hour drop-in center. And the focus of this portion of the program would be to provide harm reduction, public safety, addiction education, and will be a link to provide immediate access for those clients that want to go into the longer 28-day program. And then, of course, future more 6-month to 1-year program as we talk about phase 3 of this plan. The Crisis Triage and 24-hour drop-in center is an opportunity to create a space where individuals can feel safe. They can also be being released from incarceration from the county jail, local jails, and also from the Behavioral Health Institute. And this facility can be a place of transition for them to have a safe space to rest and get their feet under them before they go on into the world. Now, the Crisis and Triage Drop-in Center also creates a huge access point for public safety, meaning that law enforcement and those individuals that come in contact with community members who do not need to be incarcerated, but need more of some support and access to treatment and services, whether that's mental health or addiction, can be dropped off at this center 24 hours a day. In the morning, if it's somebody that's dropped off in the evening, in the morning, they're given services and access and an invitation to go into long-term treatment. If they choose not to do that, then we send them on their way and we'll say, we'll see you in a couple of days, or we'll see you tomorrow. Many of the individuals that will go to programs like this are for the most part called our frequent flyers, right? They're individuals that tend to recidivate through our programs, in certain instances clog up emergency rooms because they seek services in those facilities, which in a 24-hour crisis center, we can serve those needs and free up space at our emergency rooms, especially now with COVID and the need for more ICU beds, as we're hearing from Alta Vista. The second portion, and again, a huge component of this phase one, as Sheriff Lopez mentioned, and I can't say enough about Sheriff Lopez's leadership in being an example for the rest of the country and our state that law enforcement can be an advocate for behavioral health services, can be an advocate for developing these continuum of care and gaps in our communities. So thank you, Sheriff Lopez, for your leadership in that. One of the other things that we've talked about, as Matt mentioned, and we have to be very cautious here, given the separation of adult versus adolescent services. This center right now is for 18 and older, so it is for adults. However, we have talked about other opportunities to develop adolescent services as part of this larger continuum, because we know, unfortunately, in our communities, generational addiction is very much prevalent and alive in our communities, and we have to address that at every level, as Matt mentioned. The last piece that I want to mention here under phase one is a training center of excellence. I think that with the experts that we have, not only here presenting to you today, but Las Vegas has such a rich abundance of experts in the community, not only from health, but to mental health and to addiction, that there's opportunities for this center to develop a continuing education component, as well as an intern placement program for Luna Community College and New Mexico Highlands University. And now we know that for master's level social workers, we can now start to bill for some of those hours, which is extremely exciting. And having an intern program attached to this regional crisis and treatment center can be a huge boost in the arm economically as well. Phase 2 of the center, and I'll end with this phase and then briefly mention phase 3. Phase 2 is really then growing this program to add more beds to the 28-day program as dictated by the data and research that we're seeing from the use of services, right? So over the first year or two, we want to study to see how many beds do we have out of the 25 that are full, what's our census regularly, and then to seek additional funding to expand that as we need it. I'd venture to say, and I've advocated for this for a long time, I'd venture to say that this Northeast Regional and Crisis Center and Treatment Center is going to be a draw for this region of the country. So when we talk about Colorado and surrounding communities, you know, there may be a need for us to really consider that those referral streams as well. So phase 2 is more adding additional beds and then also collaborating, whether it's on site at this facility or seeking different buildings or structures that already exist to create a transitional housing component. And there's tons of models out there. One that Bernalillo County is currently implementing is a small house community, right? Small cabin, where there's 5 small structures on the facility, and these individuals that graduate from the 28-day program go into this transitional housing program, live there at the facility, still seek services and get served at the center that we're talking about. But then they also work in the community and they start to contribute back to community in different ways. Phase 3 of this plan is much bigger, the bigger dream. This is really identifying, in this center, the Comprehensive Recovery Center that we're looking at for phase 3 is a totally separate building, unless we see the opportunity to expand at this current site with the land that surrounds it. We would like to see a center built offsite in a more rural community that can connect to culture and connect us back to nature in a sense, that can serve as the long-term treatment facility for those individuals that may seek a higher level of care. At that level of care, these individuals would be expected to stay 6 months to 1 year. But for many individuals that have to leave their community and get uprooted from their culture, we see the opportunity to keep them in our community and treat them here. And I think that's a huge component and success that we see as a benefit to keeping families together. And really with the work that El Centro and other community programs are doing that right now with women and children's programs, we see an opportunity to really help foster the family and the family unit together again and heal as a community. And I'll end you with this, commissioners. As Matt said and Sheriff Lopez said, the opportunity is now, and we see the stars aligning for us with the state, you know, really looking at supporting this. We see the opportunity through billable hours, through Medicaid expansion, for us to really sustain and have those providers that are selected to provide services in the center to be whole financially long term. And we're hopeful that you vote yes today in support of this plan. With that, I will stand for any questions. And of course, thank you to the commissioners once again for hearing us today.
Thank you, Dr. Romero. Before we proceed, I have a question to our legal counsel. Dave, have you had a chance to review the proposed resolution? And if so, are you okay with the actual resolution being presented?
Mr. Chairman, I've had the opportunity to review. Mr. Chairman, I've had the opportunity to review the proposed resolution.
Still muted.
And it is legally appropriate. As a matter of fact, we're making large that I would suggest could be modified in the future. For example, the county has its opioid lawsuit going on, has actually suit going on at this time. And there's always been talk about if we're able to cover any money there, that would go towards helping with addiction in San Miguel County. So the answer to your question is yes, the resolution is legally appropriate.
Thank you, Mr. Attorney. A question to Mr. Lopez or Sheriff. Are you there, Chris?
Yes.
Okay, before we proceed, you and I have discussed this, and I understand that you want us to include this resolution as an approval today, but along that, you'd want us to include it in the ICIP plan, if I'm not mistaken?
Yes, and that is also included in the resolution. And if you like, I could read the resolution if that would help.
Yes, please go ahead and read it.
Okay.
Thank you, Mr. Lopez.
Thank you. A resolution declaring drug abuse, alcohol abuse, and addiction a public health crisis in San Miguel County. Whereas the crisis caused by the COVID-19 epidemic has intensified already serious mental health, drug abuse, alcohol abuse, and addiction problems within San Miguel County. And whereas the effects of drug and alcohol abuse are devastating to the addicted, their families, friends, and the community as a whole. And whereas deaths resulting from drug abuse, alcohol abuse, and addiction are at historically high levels never before seen in the county of San Miguel. And whereas the economic effects of drug abuse, alcohol abuse, and addiction on the entire San Miguel County community are devastating, including the burden on health, law enforcement, and detention resources. And whereas detoxification and treatment are crucial elements in the fight against drug abuse, alcohol abuse, and addiction, the county of San Miguel lacks public detoxification and treatment facilities. And whereas San Miguel County is engaged in joint efforts with the city of Las Vegas, Alta Vista Regional Hospital, New Mexico Highlands University, El Centro Family Health, Mora Valley Community Health Services, Pecos Valley Medical Center, and area health education centers, New Mexico Department of Health, Behavioral Health Service Division, and several other agencies to open detoxification and treatment facilities within the community. And whereas San Miguel County and the city of Las Vegas have partnered with other local agencies to funding through grants to facilitate more available access to behavioral health services, including those directed at drug abuse, alcohol abuse, and addiction. And whereas San Miguel County has developed a program of case management services, patient care to facilitate activism within San Miguel County detention, which enables inmates to begin treatment and upon re-entry into the and provides access to services, drug abuse, alcohol abuse, and addiction. And whereas law enforcement agencies and justice partners to include San Miguel County Sheriff's Office, Las Vegas Police Department, 4th Judicial District Attorney's Office, and the 4th Judicial District Court have been working together with our healthcare providers to create a law enforcement assisted diversion program within San Miguel County, which will provide direct access to services directed at substance abuse for those who come into contact with law enforcement and qualify for the program. And whereas San Miguel County has implemented a Narcan program in which all public safety agencies within the county carry and have been trained in the administration of Narcan to counter opiate overdoses. And whereas the problem of drug abuse, alcohol abuse, and addiction is regional and demands cooperation and resources from all levels of government, as well as from nonprofit and private sectors. Now, therefore, be it resolved by the Board of San Miguel County Commissioners that drug abuse, alcohol abuse, and addiction are a public health crisis in San Miguel County. And now, therefore, be it further resolved by the Board of San Miguel County Commissioners that San Miguel County declares its commitment to intensify and expand its fight against drug abuse, alcohol abuse, and addiction. And now, therefore, be it further resolved by the Board of San Miguel County Commissioners that San Miguel County declares its commitment to a regional approach, incorporating all levels of government, as well as private and nonprofit sectors in the fight against drug abuse, alcohol abuse, and addiction. Now, therefore, be it further resolved by the Board of San Miguel County Commissioners that San Miguel County partner with Mora San Miguel Guadalupe Local Collaborative 4, MSG LC4, to serve as a local government partner and fiscal agent in an effort to achieve the creation of the Northeastern Regional Crisis and Treatment Center. Now, therefore, be it further resolved by the Board of San Miguel County Commissioners that San Miguel County demonstrate a commitment to the importance of acquiring a center such as this to serve and address the mental health and addiction needs of our community by adopting the Northeastern Regional Crisis and Treatment Center as a priority on the ICIP. Now, therefore, be it further resolved by the Board of San Miguel County Commissioners that San Miguel County apply for funds through the state legislature for the purpose of startup, programmatics, and general services to cover shortfalls consistent with the creation of a new center as such. Now, therefore, be it further resolved by the Board of San Miguel County Commissioners that San Miguel County will continue to support this initiative with the allocation of resources to assure the creation and sustainability of the Northeastern Regional Crisis and Treatment Center through all phases.
Thank you, Sheriff Lopez. You know, before I ask for approval of the resolution or for action of the resolution, I'd like to ask our interim county manager, Melinda Gonzalez, what her input is regarding this. I know that she and I have talked about it. You and I have talked to her about this. And the only concern that I have is that we not impact the county's general fund when approving a resolution like this. And so at this time, I'd like to ask our interim manager if she has any input on this.
Mr. Chair and Commissioners, thank you for I have met with our Sheriff Chris Lopez about the different possibilities of the county obtaining funds for this project. One could be for the building and another one for services that are rendered. I don't see at this time, I'm hopeful that the funds that are applied for are funds that will be used directly for those services and will not require any additional dollars out of the county. Of course, staff will have to be involved in running this and monitoring the grant, but not any out-of-pocket funds that we could think of at this point in time.
Thank you. Thank you, Madam County Manager.
Chairman, this is
Commissioner
Tom
Medina.
Thank you, Mr. Chairman. First of all, it's been amazing work that this group has done. I'm very impressed with all your work you have done. And I really thank you because it's something that's really needed in San Miguel County. I'd like to congratulate our DA, Mr. Tom Clayton, and good luck to you in your upcoming 4 years. And I have a question, Mr. Clayton. When you're going to be prosecuting these offenders, will you or will it have to be like the judges that will court commit these individuals to this program?
Thank you, Mr. Chairman, Commissioner Medina. It'll be a joint effort. I think there's various efforts that are going to be done. One, the LEADS program that the sheriff talked about, that would be law enforcement assisted diversion. It would be at the front end. It wouldn't even come to the judicial system, which is the ideal location where we catch the person at the front end. Obviously, hardcore recidivism kind of individuals, we're going to have to, they're already in the criminal justice system. Those would be, Mr. Medina, those individuals would have to be through any kind of judicial kind of court commitment, whether that's through a plea agreement, a court order, or something along those lines. But I think upstream, as Mr. Probst talked about, Matt talked about, let's get them sooner rather than later, the LEADS program. We've been looking out. I reached out to the Alamosa program. Mayor Trujillo talked about this is a program that he's looking at. And I reached out to the city manager there, and they're going to be providing us some information as to how they do it. Now, whether or not that fits San Miguel County, I think, will have to decide that. But a LEADS program would be at the front end. In addition, we do have the drug court program, which is run by District Judge Gerald Baca. It has outpatient track, but they can, I believe, incorporate some of the elements of inpatient as part of their outpatient, because as many we know, substance abuse and getting off the addiction is a lifelong endeavor. And so there will be times that we anticipate the person will fall off the wagon, will go back to the narcotics for whatever reason, life's challenges. And hopefully we work together. So it's going to be a collaboration between at the front end, even before they get into the criminal justice system, that'll be with law enforcement, but also through the courts at the back end, if they're convicted of an offense, and we place them on probation and we can commit them to the program. In addition, our office, and one of the questions I think Ms. Gonzalez was talking about, the commitment and the resourcing and how it's going to impact, and I appreciate that, Chairman Garcia. It is going to be an allocation of resource, and hopefully through providers, we can provide the actual services. But our office here at the District Attorney's Office, I've converted one of my FTEs from a lawyer position to a case management kind of program, created a programs director. And she's going to be tasked with identifying all the resources within the region, but also statewide, and so that we can divert people out of prison, out of jail. One, for the health of our community, but also for obvious reasons, it's very expensive to incarcerate somebody. And the net results are, we know corrections doesn't necessarily mean corrections. We're warehousing our people. We need to turn away from that. Now, there are some people, unfortunately, prison is the answer. And that, I'm not going to shy away from that. Hardcore individuals that cause violent harm to our community, rapes, murders, shootings, things of that nature. But addiction is an illness, and I think we all recognize that. And if we can do what we can to help that, we'll divert them. But to answer your question, Mr. Bedina, it's going to be a continuum from the very beginning to court order.
Appreciate that. Thank you, sir.
Thank you, DA Clayton. Do we have any other comments or questions? Commissioner Trujillo.
So I'd like to commend the group, the panel, Sheriff Lopez, Mr. Probst, Dr. Romero, Yolanda, DA Clayton. It's an amazing group of people that you've brought together, and we've heard it from many elected officials at the state level that if there is no collaboration, we really don't have a chance at getting funding. And this is a perfect example of the collaboration we need to make this thing happen. Ms. Cruz, you mentioned earlier that this is legacy level work that you are doing. And I appreciate that. I see that this can become part of all of our legacy, is to heal our community and get the people help that need help most, and get them to be productive citizens and participate in our community as productive people, as teachers, as mentors, as just productive citizens. And I think this is a huge opportunity, and I just wanted to thank you all for the group you've put together and how you've done it, your method, your vision, everything. And I just can't see that this thing will fail. And I for one I'm ready to get this resolution approved and do whatever I can for you all to make sure that we get the funding from Santa Fe and get this thing moving as fast as we can. Thank you all.
Thank you, Commissioner Trujillo. Any other comments or questions?
Mr. Chairman, I'd like to also offer a few comments, and same ditto, congratulations. And it is wonderful to see you back, Yolanda, and to know that you haven't, your persistence and perseverance over 10 years. Same for Matt, Sheriff, and DA Clayton. It's really wonderful to see the level of law enforcement district attorney involved at this end. and show concern for our community in the up end of the treatment rather than just throwing them in jail and trying to prevent the worst of the situation and try to offer our hope and opportunity for our people that are sick in our community. So this is very exciting. I'm happy to support it as well. And Councilor Romero, I couldn't hear you when I think you talked about whether or not some of the money, if we get anything from the opiate settlement, that we steer that, direct the money into this project and into this facility. So I'd like to see how we can continue to support it. And it's just very exciting to be here at this front end, bringing the services to our people. So thank you all again. Thank you very much.
Thank you, Madam Vice Chair Varela. I'd like to add a few comments as well. You know, I've had the opportunity to visit with the 100% community, being Robes and Sheriff Lopez and the rest of the group that's here. We've been in meetings quite strongly over the past couple of months to get to where we are today. You know, we visited with the facility that we're talking about converting into this program, and I'm excited on. I've also visited along with some of the peer commissioners. I've visited with some of the local legislators, and they too support this effort. You know, they're fully aware of what we're trying to do here, and they are in. I don't see where this project does not have any support at all. You know, there hasn't been that I have spoken to that is against this. And so, any other questions or comments? I'd like to open the floor to act on this proposed resolution. Do we have a motion to approve the resolution as submitted?
Mr. Chairman,
Yes, sir, Mr. Medina.
I'd like to make a motion, we proceed and get this thing going. And it's a lot of work you guys have done, and I thank you very much because it's something that's going to be very much needed in all our counties, and it's going to help a lot of our families. Thank you, guys.
We have a motion by Commissioner Medina. Do we have a second?
Second, I make a second, Mr. Chair.
We have a second by Commissioner Varela. All in favor signify by saying aye.
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 All those opposed, same
Aye.
sign. At this time, I'd like to take a roll call vote, please. Do we have someone from the clerk's office?
Yes. Chairman Harold Garcia,
Yes.
Madam Vice Chair Janice Varela,
Yes.
Scotty.
Commissioner Max Trujillo, Commissioner Max Trujillo,
Yes.
Commissioner Martin Sena,
Yes.
and Commissioner Kenneth Medina.
Yes, ma'am.
We have a full support on this resolution. Thank you very much, Sheriff Lopez, and all the presenters here today. We have a fully supported resolution. Thank you, Sheriff Lopez, and all those who presented today. We look forward to making this thing hopefully happen in the near future.
Thank you.
Thank you, Chairman and Commissioners, for giving us the opportunity and for setting in motion something that I think is going to be great for them.
Thank you.
Thank you. The next item is Infrastructure Capital Improvement Plan. And we have Mr. Robert Archuleta, our Planning and Zoning Division Supervisor, to present.
Good afternoon, Mr. Chair and members of the commission. Can everybody hear me?
Good afternoon. Yes, we can.
Good afternoon. Yes, sir.
Okay, thank you, Mr. Chair. So we have an approved ICIP through resolution that was approved a couple of months ago. And as we can tell by the previous discussion in the previous agenda item, that there is some interest in approving some additions to the ICIP. You have before you an ICIP summary sheet, which kind of outlines all the projects that we have submitted to Department of Finance and Administration. So one of the things that we can do is we can amend an ICIP. I have made contact with DFA, and this is a process that I've been through before when I was at the city as well. So we can amend the ICIP and add projects to the ICIP. I simply have to just send an email to DFA, and then they give me permission to proceed. Once I add that project, they review it and then come back with an approval. So at this time, I would open it up to any questions or discussion from the commission regarding the ICIP.
Okay, we would like to include what we just approved as part of it. Although the ICIP that we have before us is more of a local San Miguel County ICIP. And so we're looking at a regional approach with what was just presented. And so I'd like to have that included in there with ICIP. Along those same lines, we have item number 8, which is public safety communication system. In talking to Commissioner Trujillo and our last special meeting that we had, Commissioner Trujillo brought up the issue about broadband services in San Miguel County, and he'd like to seek legislative funding support this year from the legislature for that, because it's a very much needed approach. And so I'd like to modify the number 8 under public safety communication system, maybe to include broadband services, because broadband is part of communication, and we feel that we can incorporate that into the emergency fire and safety program that we have for San Miguel County. And so,
Mr. Chair, if I may, can I make a recommendation regarding that?
Sure.
So because item number 8, the public safety communication system, is already an approved project, and it's also fully funded, and it's also encumbered 100% to move forward towards completion, I would recommend creating a new project strictly referencing broadband.
Okay, and so how do we know that it's fully funded? How do we know that? You know, because broadband is part of communication, and it could be an ongoing thing year after year.
Well, the communication system is specifically for changing from analog to digital right now, and because it's fully encumbered, meaning that DFA has already approved all the work on that project, it's kind of a standalone project. So what I would recommend is just to create a new project strictly for broadband.
Okay, do you have anything you'd like to add, Commissioner Trujillo?
I guess since we're already knee deep in we're already knee deep in this project with the communications for first responders and such, there's going to be a huge opportunity to acquire some funding for broadband expansion, because that's one of the initiatives or the directives from Santa Fe from legislature. And in order to jump on this opportunity, do you see it a problem, Mr. Archuleta, to make a standalone ICIP request? Because I know your suggestion is to separate them, but I'm wondering, is there an opportunity for us to share maybe some of the sites that the county has for communications towers, and include those sites for a broadband tower or anything like that? Do you see that not as an opportunity for broadband expansion or us receiving funding if we piggyback on that appropriation that's already there? It doesn't matter to me because there's a huge opportunity one way or the other to bring in a bunch of money to San Miguel County. I know the Pecos area is hurting, Row area is hurting, Rociada, all of these rural places are really hurting for broadband expansion. And I know the governor just invited schools to come back to classroom starting February 8th, but I just don't see that it may or may not last, and it may or may not take hold, and because we're not out of the woods yet with a pandemic, and this is surely just a huge opportunity for the county to expand that service to our residents. Can you give me a little insight on that, Mr. Archuleta, please?
Yes, Mr. Chair, Commissioner Trujillo. I don't see it as a problem as being its own standalone project. Please keep in mind that the ICIP is a working document throughout the year, which can be amended. So, as time goes on and after the legislative session, you want to add more language to it, more potential for different funding sources, we can. The existing communications project will already have the infrastructure already there. So if you want to add to that later, you could. Because the public safety communication system is fully encumbered and ready for the contractors to do the work, it's kind of considered an already completed project through DFA because the money is already going to be 100% used, which is good for the county because it really makes it look good for the county because we just got these funds back in August. And, we're barely now in January, and we're already moving forward on the project. So I would highly recommend separating it and making its own standalone project.
I have a comment and a question, Mr. Chairman. And
Go ahead, Madam Vice Chair.
yes, I think that I agree with what Mr. Archuleta is saying. And if I remember from the presentation a few months ago, that Pecos was not included in that broadband discussion and my part of the county because it was a certain area and it was finite in that area that it didn't include this part. I don't know if that's accurate, but I want to make sure that when we're talking about broadband, that it does include the rural areas of the county, including the valley and Pecos and Bernal, Rociada, as you say, because we have the need all over, even in town where there's good service or supposedly service, and because of the overuse. So I just want to make sure that we're inclusive of the rural areas when we seek this. And I do have one other comment and question, Mr. Chair, and I know it's for Mr. Archuleta, and that is a process question on the ICIP. We know it's a plan and we know it's a working document and it'll change as we add to it. Do we need to have a meeting to approve each item as we present it or add to the ICIP? Or can we go to Mr. Archuleta with our projects and so anyway, to add to the ICIP, and then the other part of that will be legislative requests.
Mr. Chair, Commissioner Varela, no, all we have to do is send a request into DFA to amend the ICIP. So if the commission provides me direction today, that's all I need, and then I contact DFA.
Okay.
Yes, I'm talking about adding, like, if let's say that another project comes up between now and before the session ends, and we want to add to the ICIP again, do we need to bring it to the commission for a meeting for approval before we ask you to change it with DFA?
I'm sorry, Commissioner Varela, could you be more specific regarding, is that referencing capital outlay request or just the ICIP?
Well, it's actually a two-part question. One of them, we're talking about ICIPs now, and we're having a meeting, we're discussing this specific subject, and we're amending the ICIP and directing you to change it through DFA. So if we have another change or another addition to the ICIP, do we have to go through the process of having a meeting and have it approved by us before we request that you send it to DFA, and that's just the ICIP question.
Mr. Chair, Commissioner Varela, I would recommend that all direction to change ICIP is provided today, only because we are getting close to the final deadline to submit capital outlay requests.
Okay.
If there is a project that wants to be added in the near future, sort of close to the end of the legislative session or after, keep in mind that the ICIP process starts again back around late April, early May, where you start working on it again. So there'll also be an opportunity at that time to work on it, which is something that the county will have to do anyways.
Thank you. So the second part of the question is capital outlay requests. We know the request may or may not be in the ICIP, preferably it will be on there. And if a commissioner has a request that isn't on the ICIP or a new request that comes on, do we have to go to the commission for approval before presenting it to the legislature for request for funding?
Mr. Chair, Commissioner Varela, the direction that's been provided from DFA in past trainings is that any capital outlay request to be submitted to the legislature should be on the ICIP. However, there's been times where municipalities or county governments get in a request and it makes it through. Preferably, they would want it on the ICIP.
Mr. Chairman and Commissioners, if I might also include, the reason that we put the agenda items in this particular sequence also is that we had a meeting 2 Sundays ago with some legislative, some of the legislators and one of the senators, and what they really want us to do is to prioritize the priorities that we have. Yeah. They really want us to prioritize the top 3. Then I was also hoping that maybe we could have a 4th or a 5th in the event that that they have more monies than they anticipate. But it looks like what they're really wanting is a top 3. And the plan is in the next agenda item is to prioritize those plans and add to that listing if we need to. But whatever is on that listing needs to be on the ICIP plan, and we need to give direction needs to be given to staff to add that on there. From what I might be saying the wrong words here, but I believe that DFA is going to be turning over to the legislature the ICIP plans that have been adopted or that are on hand on February 11th. And that's where it was thought that if we have a regular meeting on February 9th, it won't give us enough time to be able to add to the ICIP plan. So just keep in mind that our next action is to prioritize. And if we want something on that prioritization listing, we need to make sure it's on the ICIP plan.
Thank you, Melinda. You're absolutely right.
Thank you.
Mr. Chair, just for clarification, when a bill does arrive to the governor's office, one of the questions they're going to ask is it on the ICIP or not? In recent times, there has been some signatures of capital outlay that's not on the ICIP, but in the years past, they've also asked the question, is it on there? And it puts it at risk for veto, for line item veto. So I'm just kind of throwing that out there.
Thank you, Robert. Okay, so I have a question, Robert. Robert, can you...
Yes, Mr. Chair.
Okay, so can we substitute under public safety communication system? Can we substitute in its place?
Broadband?
Yes, sir. And it would be broadband communication system and expansion.
No, because it's already considered a almost completed project. Again, okay. I would highly recommend just making its own standalone project, which can be done. Okay. All right. All I need is the description of the project, the title, a scope of work, and then we create a budget, an estimated budget of how much it may cost for that expansion. and then we would ship it off to DFA for their approval.
Okay, so then, based on the previous item that was discussed, we would want to add the language from that resolution, the title of that resolution, which is developing and supporting an alcohol abuse and addiction health crisis center. And it would be a regional health crisis center that would be established in San Miguel County. And then the next one, of course, is what Commissioner Trujillo is asking, which would be expanding and facilitating broadband services within San Miguel County. And we would have to add a number to both of those. As I land, Chris Lopez, are you still here? Sheriff Lopez? It doesn't seem like Sheriff Lopez is on anymore. Okay, so we'll, if you can reach out to Sheriff Lopez, I believe that he's asking for $1 million for that facility, but it's better to clarify it with him.
Okay.
And then Commissioner Trujillo, what is your amount request?
I believe the last meeting we had, we were talking about 1.3 million.
Okay, so did you get that, Robert?
Yes, Mr. Chair.
Okay, so if you can include those two, and wherever they're included in the ICIP is fine.
Yes, Mr. Chair. We have 45 projects, I believe. So they'll just fall in line to number 46 and 47. And then again in May, and then moving into the fall, the commission will have the ability to re-rank the ICIP based on priorities in the fall.
Sounds good. Thank you, Mr. Archuleta.
You're welcome. Thank you, Mr. Chair and members of the commission.
Chairman Garcia?
Yes, sir. Chris?
The projected amount is 2.5 million.
2.5? Okay, thank you.
Uh-huh.
Thank you very much. All right, so the ICIP plan, are there any other discussions on the ICIP plan before we move on to the next item? Okay, so for the record, I'd like to go on record indicating that we have additional items to the ICIP. One is the drug abuse, alcohol addiction facility in San Miguel County. And the second one is a broadband expansion services for San Miguel County as well. Okay, moving on, item number 3, 2021 legislative priorities. And I'll turn it over to our interim manager, Melinda Gonzalez.
Mr. Chairman and Commissioners, as mentioned, we had a meeting a couple of Sundays ago with some of the legislatures, and they were asking what the county's priorities are. They have been provided with the capital outlay requests that were approved during the January 14th meeting, and that particular listing had 23 items on it. So they really want the county to narrow it down to their top 3. And assuming that the 2 items that were just included onto the ICIP plan would also be added to the capital outlay request, that would make it 25 items, of which again, we need the top 3, maybe select the top 5 just in case we're asked for that information as well.
Okay.
Each of you should have been provided a listing of the current capital outlay listings items. And then again, we just need to add those 2 items to it.
Okay, you know that I've had a chance to consume our legislative requests, and last year we gave in to some general fund projects, and we left our road projects out. I would like to see the road projects that we have proposed this year as our number 1 priority. Of course, that's just me. If the rest of the commission has any other suggestions, you know, for the top 3, my top request would be for road funds for this year. Are there any other Is there any other discussion from the commission on what you'd like to see as far as our top three priorities? And then, as mentioned by our Madam Interim Manager, she'd like to see at least two other priorities included. So you want to
Chairman,
have yes, Madam Vice Chair.
I have a question where you're talking about the roads. Are you talking about road funding for all 5 districts or just specific to the ones that you're proposing?
No, just for the entire county.
Okay, thank you. Yes, I would like to put 2 projects forth for discussion. One of them is the Comprehensive Recovery Center that we heard about today. I'd like to elevate that to the top 3, or if not top 5, at least the top 3. And also the facility for the housing for the voting machines for the clerk's office.
Okay. All right. Are there any other suggestions from the commission? Commissioner Trujillo?
So given the sentiment in Santa Fe right now in legislature and the way they're directing their money, I would ask that some kind of broadband expansion be placed a little higher on our list, because that's what they're concentrating on in Santa Fe. And it would be kind of a shame for us not to get anything, because that wasn't a high priority on our list. And they're going to dole out millions and millions of dollars during legislature. And if we can possibly get some of that for San Miguel County, that would be great. And I can have, Mr. Archuleta, I can have a scope of work and a description of the plan here pretty quickly. I can have it here by the end of next week. I can get something together that'll give us a better idea and understanding as to what amount we're asking for and what it would be for. So I'd like to see that move up, and only because that is what the legislature is concentrating on this year. And I think we should take advantage of that.
Thank you, Commissioner Trujillo. Any further input? Any further input from the commission? Melinda, do you have any suggestions at your end from the manager's perspective?
Mr. Chairman and Commissioners, one of the thoughts that I would have, and it's something that we kind of had an issue with this last year, is if we get road money that's specific to one particular road, then sometimes it doesn't offer us enough funding to cover a particular project. So I'm not sure if you would entertain the idea of just having roads in general with a dollar amount associated to it, and then have at a later point the county public works department determine the priorities for those monies. And then if that could be one item. And then of course I've heard 3 other items that were mentioned. And then if we have 4 items that were mentioned, what I could do is I could list them all and then give each of you guys the opportunity to rank your top 5. And then I could score like your top 5. Your first one would be worth 5 points, your second 4.3. And we could try to see which one weighs out at the end. If you want a weighted, I'm just thinking a weighted rate them.
Okay, so the discussion has been, the input has been roads as one, the broadband service as one, the healthcare services facility as one, and there was one more, the election, the county clerk storage facility as another. So there's 4. Are there any other from the commission that you'd like to see added?
I'd like to see added to that, Mr. Chair, equipment for public work. I think that's important that we keep that equipment up and are able to keep up with the demand with our many miles of rural roads and you know what public works has to do. I'd like to see that added to that.
Thank you, Commissioner Trujillo. I'd like to add, yes.
Mr. Chair, it's Arnold here.
Yes, sir.
If I may, I just wanted to add a little bit more to the equipment also, just to let commission know, our solid waste bins are in dire need of replacement. And we are going to need to replace quite a few of them. So I think you should seriously consider the equipment as being a priority, because that would include bins as well. Just to add that in there. Thank you.
Thank you, Arnold. I'd also like to add one more to this. We cannot leave our assessor's office and our sheriff's office out of it. And so I'd like to include the request that our county assessor has, and then also the expansion of the sheriff's office. And I'm not particularly mentioning what order those need to be, but at least we have, I think we're looking at about 7 priorities right now.
That would be correct.
Okay, can you read the 7 items to us, Melinda?
Yes, Mr. Chair and Commissioners, they're the roads, broadband, the treatment facility center, the facility for voting machines, equipment for public works, the photometry system, and the sheriff's building expansion.
That's 6. Is that 6?
That should be 7. Roads.
Oh, 7. You're right. It's 7.
Testers.
Okay, so is the commission okay with the format in which they were read as far as prioritizing them, or do you want to take a vote on them?
I like Melinda's suggestion, Mr. Chairman, on rating them. I don't know how long that would take. Can we do that efficiently, Melinda?
I think so. I already have it gridded out with each commissioner and all the 7 projects, and I could just assign, again, 5 for the first, 4 for the second, and we could figure out what the tallies are.
I like that process, Mr. Chair, if that's okay with you. I don't know how the other commissioners feel.
Sure, that's fine.
Okay. I'm not sure if we should go, would you want to go commissioner by commissioner or?
Sure. Yeah, that's fine.
Do you want to start, Mr. Chair, with your priorities?
Okay, my number 1 priority, of course, is roads. Okay. My number 2 priority would be the facility for the medical services that were discussed. And then the 3rd one would be the broadband. Any other 4 are okay in whatever order they're identified right now.
Okay, Ms. Varela?
Okay, thank you, Melinda. Okay, 1, the recovery center, 1, broadband, 2, 3, the voter storage, 4, equipment for public works, 5, assessor's system, and then roads, and then a sheriff's office.
Okay, I'm going to kind of just assign those half a point.
Okay.
Okay, and then Commissioner Trujillo?
Okay, my number 1 is roads. Number 2 is the medical facility, the detox. Number 3 is broadband. Number 4 is the sheriff's office. Number 5 is equipment for public works. Number 6 is the assessor's needs. And number 7 is the county clerk's facility to store her equipment.
Commissioner Sena?
Yes, my number 1 would be the health facility treatment center. Number 2 would be roads. Number 3, broadband. Number 4 would be the election storage. 5, equipment for public roads and bins. 6, the assessors. And number 7, the sheriff's office.
And Commissioner Medina.
Thank you, Melinda. I'd go number 1 with roads. The second one would be for the health facility. The third would be for the sheriff. The fourth for the solid waste. The fifth for the clerk, and the sixth for the assessor. Did I say that right?
So the only one, so would that mean that the broadband would be the seventh one?
7. Yes, ma'am.
Okay, the
Thank
only,
you.
you're welcome. The only one I think I numbered twice was Commissioner Trujillo. Which one did you have in priority? Was it, okay, so you had roads. Let me go over yours again. Treatment, broadband, the sheriff's building, public works facility, the pictometry, and the voting. Is that correct?
That is correct, Melinda. Thank you.
Sure thing. And what I could do too is if I have the opportunity, I could try to share my screen and let's see. But the way that I'm coming up with this is that the treatment center is number 1 with 22 points. So what I did is I did 5, 4, 3, 2, 1, but because we had 7, I went to 0.5, 0.25 for the last 2. So the treatment center with 22, roads with 19.25, broadband with 13.25, and then the facility for voting machines, the next, equipment for public works, the sheriff's building expansion, and pictometry. So I don't know, let me try to see if I can move this over, and if Diego could allow me to share my screen, then just bear with me, then you guys could just review it and see it. So, and this is what I just listed was these projects here. Gave each one a scoring. You could just ignore these ones on the bottom. But so these are the totals for each one. So there's a treatment center, roads, broadband, facility for voting, equipment, sheriff's and pictometry.
Excellent. Thank you, Melinda. That was fun. That seems very fair way to do it. Thank you.
You're welcome.
And I agree with that, Melinda, and thank you very much for allowing us that opportunity. How does the commission feel about this? We do need to take a vote on it because it's an action item. And so if everyone is okay with it, are there any questions or comments? Hearing none, do we have a motion to approve the legislative priorities as outlined by our interim county manager?
Motion to approve, Mr. Chair.
We have a motion by Commissioner Varela. Do we have a second?
Second.
We have a second by Commissioner Trujillo. All those in favor signify by saying aye.
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 All those opposed? Same sign. Motion carries. Okay, so at this time, I'd like to turn it over to our county attorney so that he can lead us into our closed session. So
let me ask for consideration and a motion to go into executive session for limited personnel matters submitted by 1068 of Mexico.
Excuse me, Mr. Chairman. Mr. Chairman, can you hear me? Can you hear me? This is Geraldine.
yes, we can.
Hello?
Yes, Geraldine, go ahead.
I cannot hear Mr. Romero at all.
Okay.
No, I can't. We
He's
cannot
muted.
for recording purposes.
And I can't hear him on this end either.
You're muted, Dave.
Mr. Romero, can you speak up?
Let me try. Can you hear me now?
It's echo.
No, we can't.
He's muted.
It's like an echo.
That's correct. That's an echo.
There.
Can you hear me now? Can you hear me now?
Yes.
Yes.
Mr. Chairman, Board of County Commissioners, let me ask that we have a motion to enter into executive session to discuss limited personnel matters as permitted by the New Mexico statutes annotated 1015-1 of the Open Meetings Act. More specifically, we wish to talk about personnel matters regarding specific county departments, the detention center supervisor, and if we would have a roll call motion to do that.
Okay. Our county attorney has recommended that we go into executive session. So before we go into executive session, do I have a motion from the county commission to do so?
So move, Mr. Chair.
We have a motion by Commissioner Trujillo. Do we have a second?
Second.
We have a second by Commissioner Sena. All those in favor signify by saying aye.
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 Can we have a roll call vote, please? Is the clerk's office there?
Arlene, are you there? Okay, I'll do it. Chairman Harold Garcia,
Yes.
Madam Vice Chair Janice Varela,
Yes.
Commissioner Max Trujillo,
Yes.
Commissioner Kenneth Medina,
Yes, ma'am.
Commissioner Martin Sena.
Yes.
We are now in executive session.
Okay, so do I log out or do I just stay? How do you want me to handle this? Do I leave the meeting? I hear you're gonna call me on my cell. That's fine. So I'm gonna leave the meeting.
Test. Can everybody hear me?
I can hear you.
Cool. We're waiting for Commissioner Medina to log on so we can proceed. Okay. Are we still on, everybody there? Okay. I'm going to turn it over to our county attorney so he could do what's necessary for conclusion of the executive session.
Thank you.
Mr. Attorney?
Yes, sir. Mr. Chairman, members of the commission, there are three things I would like to see done in this order. The first item is to move to get out of executive session with a second and a roll call vote. The item after that is I will certify for the record that only those items described in the agenda were discussed in executive session. And then we will go into regular session, and I don't think there's anything else to discuss except adjournment.
Okay, thank you, Mr. Attorney. Do we have a motion and a second to go back into regular session? Do we have a motion?
Mr. Chairman, I move that we go out of executive session.
We have a motion by Commissioner Trujillo to go out of executive session and to go back into regular session. Do we have a second?
Second.
We have a second by Commissioner Medina. All those in favor signify by saying aye.
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 If we could have a roll call here, Mr. Chairman.
Do we have the clerk's office available for roll call? Anyone at the clerk's office?
I can call a roll call for you.
There she is.
Chairman, can you hear me?
Yes.
Hello?
Yeah, we can hear you.
Chairman Harold Garcia,
Yes.
Madam Vice Chair Janice Varela,
Yes.
Commissioner Max Trujillo,
Yes.
Commissioner Martin Sena,
Yes.
and Commissioner Kenneth Medina.
Yes, ma'am.
Let the record reflect that we are now in open session. Mr. Attorney, next order of business.
Mr. Chairman, members of the Board of Commissioners, let me state for the record that only those items as permitted by the Open Meetings Act were discussed in executive session, including the items described by the agenda and nothing else, which would be limited personnel matters as permitted by 1015(1) of the Open Meetings Act, and specifically personnel matters regarding the detention center supervisor for San Miguel County Detention Center.
Thank you, Counselor. Any further discussion at this time? I think that those are the only items on the agenda. Do we have any further discussion before I ask for adjournment? Hearing none, do we have a motion to adjourn the meeting?
Motion
to adjourn.
Mr. Chairman.
We have a motion by Commissioner Trujillo. Second. Do we have a second?
Second.
Second by Commissioner Medina. All those in favor signify by saying aye.
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 All those opposed, same sign. Motion carries.
Mr.
Meeting-
Chairman,
Yes, sir.
why don't we have a roll call vote? And the reason I'm calling for roll call votes is that's one of the things I learned about from the Attorney General's office today, is now that we've gone to video in person, that for the record proper, it's always better to get into the habit of knowing who voted in which way, even if it's something as simple or unanimous as an adjournment. So let's just make that into a practice. Roll call
Thank you,
votes
Mr.
for all
Attorney.
votes.
Thank you, Mr. Attorney. Can we take a roll call, please? Is the clerk's office there?
Chairman Harold Garcia,
Yes.
Madam Vice Chair Janice Varela,
Yes.
Commissioner Max Trujillo,
Yes.
Commissioner Martin Sena,
Yes.
and Commissioner Kenneth Medina.
Yes, ma'am.
Yes. Okay, thank you very much. The meeting is now adjourned at 4:22 p.m. Thank you, everyone.
Thank you, everyone. Have a good one.
Thank you.
Bye.